I want to thank the Leader of the Opposition for putting this motion on the table, and I want to underline a particular thing she said, Speaker. I want to salute the community organizations right now on the front line in Ontario's mental health crisis. They're the ones holding it down, and the mental health workers at the outreach points. They're the ones holding it down, and frankly, Speaker, I'm worried about them. I'm worried about them because the amount of burnout in street outreach work and mental health work alarms me. But despite that, Speaker, I want to talk about a success story. I want to talk about a group called Soul Space in Ottawa. It's a grassroots network of harm reduction and street outreach workers who got together to found respite services for themselves, to have excursions, to have workshops, to have simply talk over coffee about the people they had lost, clients they had lost, friends they had lost who worked in this field. And I want to say for the House, we are all going to agree, I think, that it is a tragedy that people think every single second of this day. There are people, our neighbours, who are thinking about ending their own life. That is a tragedy, that we lose people to suicide, that we lose people to addictions and overdose. But the double tragedy, Speaker, is that for those people who step forward to work in the field of mental health, if we are losing them to burnout, that is a preventable problem this House can solve. Preventable problem. Soul Space is an organization supported by First United Church back home in Ottawa Centre. It is a grassroots network of harm reduction and street outreach workers, but it needs to be funded by Health Ontario. Just like another fabulous organization I want to mention, Counselling Connect, an organization that right now in our city is supporting over 700 people a month. And when someone is in mental health crisis, Speaker, all you need to do is pick up the phone, write an email, and this organization can get you access to cognitive behavioral therapy within 24 to 48 hours of intake. Because they're networked to 20 different community organizations that are stretching the resources they have as best they can to offer people support. They have saved lives, Speaker. I heard about a mom and her son who had gone to our children's hospital, and they had actually been helped at the point of crisis, and the son is making recovery. But let it fund those community solutions. Let's not make them work on shoestrings, and let's make sure everybody wakes up tomorrow wanting to continue their life to make Ontario a great place.